yes.
Yeah, just
I can also
Vineeta,
hear you.
would she be able to hear me?
Ashwini,
Yeah,
go
yeah,
ahead.
yeah. I would just like to introduce you, Vineeta, 1 minute. So the next speak, no, my voice is not audible.
I'm not able to hear you, Ashwini.
Can I use the caller? Jobin, if it's complicated, I can use that. Now, yeah. Can you hear me now, Varun? No, Vinita also and Varun is checking whether we both are audible. Yeah, next
Ashwini, we are not able
presentation.
to hear you.
Doctor, can you hear me?
Zero. Can you message?
Jobin? No, but she is not able to hear me. You can see that? But he doesn't know what to introduce. Yeah. Varun, can you please tell her that I'll introduce her and then she can start? She doesn't necessarily have to listen to my introduction. I'll call her. Ashwini, can you call her?
Ma'am, just for checking, can you talk so that we will check whether the auditorium can hear?
Yes.
Okay. Um, let me check with your
Unmute.
Jobin. Can you hear Vineeta, ma'am?
We can hear
I can
Varun.
listen you, but there is some sound, means echo. There is echo.
Yeah, I.
Okay, I'll begin with her introduction. Vinita couldn't join us.
You're able to hear her.
So
Okay.
we have two
So they are able
online
to hear
speakers
her,
today.
hear you. So you can go ahead with.
Yes, yes.
Um,
I can go ahead because it's not matter whether I can listen you, but you must listen me properly.
correct. So, Jobin, as soon as Madam is ready to present, can you just give us a thumbs up in the message? Log out Madam, it becomes very difficult to again because of the room.
Okay, we can start. She is from Integrative Cancer Treatment and Research. Just that much introduction, then maybe you can.
Ma'am, you can start now. Ma'am, you can start now.
Yes. Have you shared my screen? Have you shared my slides?
Yeah, so can you, Jobin, can we have the slides?
Can I see slides?
Yes, ma'am. Just give us a minute.
Yes.
Give us a moment. The slides will be on the screen. Madam, the slides are on the screen. Are you able to see them? Ma'am, are you able to hear us? Ma'am, are you able to hear us? The slides are on the screen. You can start now. No, you have to unmute. Ma'am, you have to unmute. We are not able to hear you.
Now
Yeah.
can you listen me?
Yes, I can hear you.
Yes.
You can go ahead. Thank you.
So I'll start my lecture now.
Yes.
Today I am presenting Integrated Cancer Treatment and Research Center of Bharatiya Sanskriti Darshan Trust, which is located at Wagholi, Pune. Our center is recognized as Center of Excellence by Ministry of Ayush, supported by Department of Atomic Energy for Radiotherapy Department, and supported by Tata Trust for Panchakarma Hospital for cancer patients and research labs and various research activities. It is affiliated to Indian Cancer Society and empaneled under Mahatma Jyotiba Phule Jana Arogya Yojana and Pradhan Mantri Jana Arogya Yojana. So the main title of my lecture is Cancer Management and Ayurveda. Next. We have started our cancer research project in 1994 by Revered Prabhakar Keshav Sardeshmukh Maharaj, who was an authority in Indian medicine and Nadi Pariksha. Dr. S.P. Sardeshmukh, a renowned Ayurvedic physician, and Dr. Arvind Kulkarni, radiation oncologist. Aim of the project was to reduce sufferings of cancer patients, improve quality of life of cancer patients, minimize side effects of chemotherapy and radiotherapy, and to increase survival. So till date, we have treated more than 13,000 cancer patients of various types and stages and of various grades with adjunct Ayurvedic treatment. And the speciality of our project is that we are delivering a tailor-made Ayurvedic treatment to all patients. That means patients are evaluated from Ayurvedic perspective. We try to diagnose them from Ayurvedic perspective. We try to understand the risk factors, that is Hetu, Samprapti, and Nidana from Ayurvedic perspective, and a tailor-made treatment is given to each and every patient. So what are the benefits we observed in this project? That the improvement, there is a drastic improvement in quality of life, remarkably less side effects of chemotherapy and radiotherapy, and increase in disease-free survival, overall survival, and progression-free survival in cancer patients. That means if the reported survival of some aggressive types of cancer is 6 months to 1 year, with the help of Ayurvedic treatment, we can increase overall survival or disease-free survival in many cancer patients. Next one. As we are giving tailor-made treatment to cancer patients, similarly, we have conducted 4 clinical trials with the funding of Tata Trust. In these 4 trials, 400 breast and oral cavity cancer patients were enrolled. And what were the findings of the trial was the Ayurvedic medicines which were used in clinical trial, that chemo recovery kit, are highly effective for minimizing side effects of chemotherapy, increase immune status, and decrease oxidative stress in breast cancer patients. So in this trial, we started Ayurvedic treatment to 120 breast cancer patients along with chemotherapy. 60 patients received only chemotherapy and 60 patients received Ayurvedic treatment along with chemotherapy. And we studied their chemotherapy toxicities, that is side effects of chemotherapy, biochemical markers, their radiological assessment was done, and immune markers were studied like IL-1, IL-6, IL-8 and IL-10. Oxidative stress markers were also studied in this study. And what we have observed, that Ayurvedic medicines are really effective in minimizing side effects by means of improving immune status and oxidative stress. Similar findings were observed in second clinical trial, that was the clinical trial regarding oral cavity cancer patients receiving radiotherapy. So these patients were also benefited with reduction in side effects, increase in immune status, and reduction in oxidative stress. Then third and fourth clinical trials were carried out for triple negative breast cancer patients and breast cancer patients having BRCA1 and BRCA2 mutation. So in these patients, the type of cancer of these patients is very aggressive. There are fair chances of recurrence within 1 to 3 years. So we started conventional Ayurvedic treatment after completing conventional treatment, and we assessed them for 3 years, and still the assessment is continued. We treated them with oral Ayurvedic medicines for continuously 3 years, and we administered 4 sets of Panchakarma treatment to these patients. And what we have observed, that all these patients had disease-free survival for 5 years, and that was an amazing observation, that it showed that Ayurvedic treatment really helps to increase immune status and to improve quality of life and disease-free survival. Based on these 4 clinical trials, we filed 8 patents of Ayurvedic formulations nationally and internationally, which are effective in treatment of various types of cancer. More than 20 publications in national and international peer-reviewed journals are done with the help of these trials and our clinical data. Next. So this was our background work. So now I will just give an outline of futuristic vision and roadmap to achieve it. So integrative oncology model is essential for the benefit of cancer patients. So at our center, we have an integrative oncology center. That means we have a Ayurvedic wing, allopathic wing, Ayurvedic research department, and basic research or mechanistic research department. So all these 4 departments are essential for developing integrative oncology model. And this model is very important or essential because, as you all aware of the fact, that only Ayurvedic treatment or only conventional treatment is not enough for cancer patients. Conventional treatment is essential to reduce the tumor load, but Ayurvedic treatment is essential to increase the quality or improve the quality of life and to increase disease-free survival of cancer patients. Once cancer patients have completed their conventional treatment, they do not have any option in modern medicine to prevent recurrence or metastasis. So this is the area of research, and this is the area where Ayurveda can contribute. So Ayurvedic treatment and conventional treatments should go hand in hand with for the benefit of cancer patients. So we'll see what minimum requirements are there for Ayurvedic wing. We should have One should have Ayurvedic OPDs for cancer patients. There should be also specialized cancer OPDs. These specialized cancer OPDs should have the cancer OPDs for special types of cancers like breast cancer OPD, cervical cancer OPD, head and neck cancer OPDs, hematological cancer OPDs, brain cancer OPDs. So specialized OPDs are required for pinpoint treatment from Ayurvedic perspective. Ayurvedic Cancer Hospital, that is IPD, is also essential. There should be a state-of-art Panchakarma hospital. At our institute, we have a 60-bedded state-of-art Panchakarma hospital dedicated for cancer patients. It is funded by Tata Trust. So a patient should get all types of Panchakarma treatment and allied procedures like Shashti Upakrama in that hospital, and should get proper diet according to Panchakarma treatment in that hospital. So Ayurvedic kitchen is also a part and parcel of this wing, and it is very important because we are advising Pathya Pathya to cancer patients and all patients, which should be followed properly when they are admitted, and they should get a guideline that what type of diet they have to follow at their home. So Ayurvedic kitchen is very essential. Medicines play an important role in any type of treatment. We all are aware of the fact that Charaka has explained about Chikitsa Chatushpada. Vaidya and medicines are very important parts of this Chatushpada. So Aushadhi Nirman, that is Ayurvedic pharmacy, should be well equipped. It should be well equipped in the form that from the raw material to finished product, each and every step should be meticulously followed in the Ayurvedic pharmacy. And this pharmacy should be associated with drug standardization laboratory, because we all aware of the fact that nowadays many scientists or allopathic physicians, they have a doubt about Ayurvedic medicines, especially about bhasmas. So Ayurvedic medicines which we are preparing according to our text should be standardized from the view of modern medicine. So it should be collaborated with drug standardization laboratory. The main raw material provided to Ayurvedic pharmacy should be proper and it should be organic in nature. So we have to associate it with Ayurvedic organic plantation. So Ayurvedic organic plantation should cultivate all the herbs which are required for cancer treatment. So these all factors should be there in Ayurvedic wing. In allopathic wing, we must have oncosurgery department, chemotherapy department, radiotherapy department, palliative care department, intensive care unit, cancer diagnostic radiology department, and cancer diagnostic biochemistry department. At our center, we have all these allopathic wings, and experts from allopathic uh, wing, allopathic perspective, are working in the departments. That means oncosurgeons, chemotherapies, radiotherapies should lead these departments and should treat cancer patients in these departments. In cancer diagnostic department, we must have basic facilities of X-ray, sonography, CT scan, MRI, PET CT, and mammography and endoscopy. So these are the basic requirements for diagnosis of cancer from radiology point of view. We must have cancer diagnostic biochemistry department, which should have diagnostic facilities of basic biochemistry tumor markers. So this is an allopathic wing. We also must have Ayurvedic research
Madam, we have
department.
2 more minutes.
Yes, yes.
Thank you.
I will finish.
Thank you.
Okay, so for Ayurvedic research department, we have to design clinical trials, we have to collect data, we have a data management system, statistics analysis, publication of case studies, publication of outcomes of dermat treatment, and publications of clinical trials. In basic laboratories, we should have molecular biology, tissue culture laboratory, immunology lab, genetic lab, animal house, drug standardization lab, and advanced research labs in this department. These laboratories must be there to confirm or it should be a proof of concept, of proof of Ayurvedic treatment concept. Next one. So we can follow many clinical studies or research from the area of cancer and Ayurveda. So there must be establishing risk factors of various types of cancer from Ayurvedic perspective so as to ascertain them carcinogens and co-carcinogen. Establishing methods to diagnose cancer from Ayurvedic perspective. Clinical trials of Ayurvedic medicines or treatment modalities like Panchakarma should be with the aim of improving quality of life of cancer patients, increasing cancer-free survival, regression of cancer, management of cancerous wounds, improving immune status, reducing oxidative stress, minimizing adverse effects of chemotherapy and radiotherapy, palliation of symptoms, and mental status of patients. Similarly, efficacy of Ayurvedic treatment or Ayurvedic principles for cancer prevention, especially in population which is predisposed to cancer. And case reports are the beauty of Ayurvedic treatment. So we have to study the case reports and publish them in international journals. Similarly, Analysis of data of patients who received tailor-made Ayurvedic treatment is also essential to see the efficacy of various Ayurvedic treatment modalities. So here I have explained outlines of futuristic vision and roadmap to achieve it. So thank you for listening my talk. Thank you.